Before turning it over to today's presenter, we'd like to give a brief introduction. Samuel C.J. Kim is currently a student at Charles R. Drew University of Medicine and Science, pursuing a master's in biomedical sciences. He graduated from the University of California, Berkeley with a bachelor's degree in molecular and cell biology with an emphasis in physiology. He also minored in music and education. During his undergraduate years, he studied cellular biomechanics in order to understand the complexity of the nuclear pore complex and its relevance in some cases of muscular dystrophy, using VMD to map out the sun-cache protein complex and run simulations of mechanotransduction while using RStudio to analyze the pathways connecting the extracellular matrix to the nucleus. He also studied how youth learn to make sense and make use of technology in the classroom, and how to support sense-making through the design of software, curricula, and teacher professional development. After graduation, he worked at a small biotech startup in Berkeley, California to help develop the world's fastest translational engine, leveraging cell-free synthetic biology, automation, computer learning, and metagenomics to unlock and identify new molecules and new chemistry. During his graduate work at Drew, he has been studying the detrimental effects of e-cigarettes and nicotine in mice, specifically researching how it is linked to obesity, hypertension, and metabolic syndrome. He has also spent a considerable amount of time doing policy research and studying the new federal Tobacco 21 law. He currently works as an ER scribe and is applying to medical school, hopefully going into pediatric medicine or pediatric oncology. I will now turn it over to Samuel Kim.
Hello, everyone. Thank you for that wonderful introduction. And so, yeah, my name is Samuel Kim, and I will be presenting today on the new federal law that was passed in December of last year, and it's the U.S. Tobacco 21 law. So the title of my presentation today is U.S. Tobacco 21 is paving the way for a tobacco endgame. And what we're trying to portray is that this federal law is going to have a significant effect in creating a nicotine/tobacco-free America, hopefully in the next 10 to 15, 20 years. But it takes one step at a time, and I'll be going over exactly how we think that's going to happen. So these are some learning objectives today. I'm going to be summarizing the vaping epidemic, I'm going to explain the key points of Tobacco 21, and I'm going to explain how Tobacco 21 is a significant public health victory for us Americans. So cigarette smoking, we know it's been considered an epidemic for a very long time. It's the leading cause of preventable disease and death in the US. It accounts for more than 480,000 deaths every year. That equates to almost 1 in 5 deaths that are related to smoking or smoking-related diseases. 16 million Americans live with smoking-related diseases, and 14 of every 100 adults currently smoke cigarettes. Now, this number is dropping slowly, which is a great thing, but it is still a huge concern because of the high rates of youth cigarette usage. And so, as that bullet point says, youth smoking rates are still high. As of 2019 CDC data, 2 out of 100 middle school students report smoking cigarettes daily, and 6 out of 100 high school students report smoking cigarettes daily. And sounds like not, 2 out of 100 doesn't sound a lot, right? But as you'll see in my next few slides, this number is very small when you compare it to the new vaping epidemic. 31% of smoking prevalence among persons below the federal poverty level. We know that smoking is a blatant health disparity. We know it disproportionately affects minority groups, including low-income communities, racial and ethnic minorities, LGBTQ plus individuals, and those suffering with mental illness. So we definitely know cigarette smoking has been and is going to continue to be an epidemic. But like I've been mentioning, Tobacco 21 is going to be a considerable step in the right direction. So, as this bullet point says, on December 19, 2019, U.S. Congress and President Trump passed and signed legislation amending the Federal Food, Drug, and Cosmetic Act, which raised the federal minimum age of sale of tobacco products from 18 to 21. This also includes cigarettes, cigars, and e-cigarettes. And This was a very considerable victory. However, the end of last year was the whole impeachment hearings, and with COVID starting to spread across the world, this kind of got brushed under the rug. Barely even saw it in media, although this was a huge, huge victory for public health. And so this presentation will hopefully give some insight into how important this victory was and what steps we can all take in the future to make sure that this continues to get more coverage and this continues to take right steps. So as I go into a little bit more about vaping, like I mentioned earlier, smoking rates are declining. Smoking rates have declined from 20.8% in 2005 to 13.7% in 2018. During that time period, ever smokers who quit increased from 50.8% to 59%. However, electronic cigarettes, vape pens, pods, e-cigs, and specifically Juul have created a new public health emergency. And if you see that, that graphic on the top right, that's a 78% increase in youth e-cigarette usage in just 2 years. Now that is very concerning, and we believe that it really has to do with the product Juul. And so e-cigarettes have been around since the early 2000s. There was one gentleman who actually created his first patent and got it passed, but he didn't have funding to get it commercialized. But another gentleman in the early 2000s actually got his patent, and his e-cigarette, or his ciga-like product, became the first widely marketed product. Juul came out in 2015, and it really started taking off in 2016 and 2017. And you can see that spike in that graph on the bottom right. It goes from, let's see, 10% up to over 20%. And so we know Juul is a huge factor in this new vaping epidemic. And on top of Juul and on top of these other products, we know that flavors are a big concern. And so we'll get into that a little more. So these new devices, globally, they're known as ENDS, and I'll try to keep it, I'll try not to switch back and forth between ENDS and e-cigs, but just know that ENDS and e-cigs are all considered, electronic nicotine delivery systems. And according to the World Health Organization, the definition of these devices is devices whose function is to vaporize and deliver to the lungs of the user a chemical mixture typically composed of nicotine, propylene glycol, and other chemicals. And here we go. So the evolution of e-cigarettes, as I mentioned earlier, the ciga-like, the first generation, is the first product that was released in the early 2000s. The story is this scientist had a father who passed away from lung cancer from chronic cigarette smoking. So he wanted to create a product that was, in essence, healthier. And so he created this, this product that would vaporize nicotine oil, nicotine juices, so that they could circumvent the combustion of cigarettes, of which has been proven to have carcinogenic chemical constituents. However, as research has been done, we've seen these products are not safe at all. And so the second generation are these vape pens. These contain of a tank and a battery. The tank is refillable with different types of e-juice. The third generation were these mechanical mods. These are, in my opinion, are more, the third generation is more of a social type of device. If you go on YouTube and you search mechanical mods, you'll see these vapors or these users creating like cloud tricks and creating these wonderful like vaping, I can't describe it, you just have to YouTube it. But a lot of the third generation products don't necessarily create the whole feeling of nicotine. It was more of kind of a movement. People vape just to look cool. And they create these like cool little, like you can design those pods and make them look really, fancy, colorful. You can get different flavors. And so from the data that we've seen, the e-cigarette usage among youth kind of tapered off in the early 2010s, so 2014, 2015. But then the fourth generation of Juul on the top right, that little USB looking stick, that came out, and that is what made vaping take off. And if you've seen a Juul, it's the size of a USB stick. It's very convenient. You can recharge it on your computer. You can recharge it on, in an outlet. You can refill the vape devices with e-cig juice. You can take it apart. You can add flavors. It really created its own product, and that's what created the whole vaping epidemic, in my opinion. And then the last generation are these new things called disposable e-cigarettes. The most popular company being a puff bar. These are very concerning as well. Juul came out and said they would ban flavors. So they did ban most of their flavors, I think in 2017. However, they did not ban menthol, and we know menthol is still considered one of the more popular products. However, in the fifth generation e-cigarettes, these puff bars, their flavors are not banned, and they're not going to ban their flavors until there's a federal mandate. And these are cheap, they're easily attainable. I've talked to my niece, she's in high school. She has friends that are puff bar dealers. And so, we really need to be aware of these new products that are coming out. And at the end of my presentation, I'll be talking about a sixth generation of e-cigarettes or ENDS type of device that's coming out that we should be aware of. And so just to summarize very quickly, these ENDS or these e-cigarette products, they contain a cartridge, an atomizer, and a battery. The cartridge contains the e-cigarette juice, which is usually has nicotine, flavorings, propylene glycol, glycerol, and in some of these new products, we're seeing vitamin E acetate, which is linked to a new disease called E-volley 10. The product uses the heating element, the atomizer, to heat up the e-juice, and then it spits out a vapor or an aerosol that the user inhales. And so, just continuing with the whole youth vaping epidemic, you see these are just some advertisements on Google. All I put in was, vaping advertisements, and these are quite scary. If you look at the bottom left, it looks cool, right? He kind of looks like a magician with all the smoke and vapor coming out of his mouth and his nose. If you look at the top right, friends don't let cigarettes buy cigarettes, or friends don't let friends buy cigarettes. They're advocating for us to tell our friends to use e-cigarettes because they're better, they're healthier. As we continue to look at some of these advertisements. So e-cigarettes are associated with creating a new generation of smokers by causing youth nicotine dependence. So, work done by both outside groups and done by Dr. Friedman and Dr. Shao from UCLA, we've seen that levels of nicotine in e-cigarette products can reach nicotine and cotinine levels substantially above combustible cigarettes. So we know cigarette smoking itself is addicting, but the addicting element is the nicotine itself. And so when these products deliver more nicotine per puff or per product, I guess, that is what's creating the nicotine dependence. And my next slide will talk about a little bit about the physiological effects of nicotine in youth. But we know whether a youth or an adult is using nicotine is very addicting. And like I mentioned earlier, the CDC has reported, a very high significant raise in e-cigarette usage at 78% alone in the last 10 years, 18 years right there. And in 2019, the prevalence of use during the previous 30 days was more than 1 in 4 students in the 12th grade. So just last year alone, 1 in 4 high school students reported using some type of e-cigarette product, whether it was a vape, whether it was a Juul, a mod, or a puff bar. 1 in 4 students. That's concerning, right? And we know that big pharma and these big tobacco companies and these new vaping companies, these companies like Juul and Puff Bar, they're specifically targeting the youth because the youth are easily manipulated, and these products look cool, and it's creating this whole new social um, movement for using these products. So why is this so concerning? 95% of adult smokers claim that they began smoking before they turned 21 years of age. 75% of adult smokers said they first started smoking before they turned 18. Around 50% of adult smokers become regular smokers, and 80% of smokers who smoke before they turn 18 will turn into daily regular smokers. So we know that the age range from 18 to 21 is a very at-risk range for smoking, or at least starting the smoke. And like I mentioned earlier, these vaping and these e-cigarette companies are specifically targeting these youth because once they're addicted when they're 17, 18 years old, they're most likely going to be addicted for a lifetime. And there's a lot of evidence out there. Once you're addicted to nicotine off these e-cigarettes, you often turn back to cigarette smoking, or you become what we call a dual user, where you start where you start vaping and using e-cigarettes, and at the same time you start smoking cigarettes. You're getting the double amount of nicotine. You're using both types of products, putting yourself at more risk. Another stat I'd like to mention is the median age of first trying smoking was 12.6 years old among middle and high school students. So 12.6-year-old or 12 and a half year old students are smoking cigarettes. And, if you're smoking a cigarette when you're 12 and a half, what's stopping you from getting a vaping product? And, that's what's creating this whole new generation, because I feel like the vaping products are probably a little easier to get your hands on. And, I'll talk about it a little more later, but you can't buy cigarettes online. Maybe you can, maybe you can't, but you can buy vaping products online right now. I can go on, there are certain websites that we've seen that are starting to vamp up their security, especially with the new federal 21 law. But last year, before the federal 21 law was passed, you could just go onto Juul and just click. It just asks you when you sign, or when you go to Juul.com, it says, are you 21 years or older? Are you 18 years or older back then? You just click yes, and it lets you into the website. You can buy however many products you want. You can ship it overnight. You can pay for overnight ship, or you can pay for 5 to 7 business day priority shipping, and you can have a Juul and its product, its charger, e-juice at your desk, in 2 days or 1 week. And anyone could do that if you had access to a debit or a credit card. And so that is why, this whole vaping epidemic is so terrible, because anyone can get their hands on these products. So like I mentioned earlier, the youth are physiologically at risk for nicotine addiction. So if you look at the chart on the right, and you compare some of the aspects between adolescents and adults, the second one is what's for me is what's most concerning, right? So in adolescents, they are more sensitive to nicotine's rewarding effects. So nicotine works because it binds to the nicotinic acetylcholine receptors in the brain and in other tissues. And when it does so, it releases dopamine, and dopamine is known as the pleasure molecule in our body. And so when you have lots of dopamine, you feel better, right? When you run or when you exercise, your body releases dopamine. You sometimes get a runner's high. There's that whole field of thought. But as your body starts to release more dopamine, your body then forms a dependency on this feeling of happiness, this pleasure molecule. And so research conducted by the Odell Group has shown that adolescents display enhanced nicotine reward and reduced withdrawal effects because they experience short-term positive and reduced aversive effects of nicotine. Furthermore, it has been shown that adolescents do not physiologically have mature brains. Obviously, we know that. And the prefrontal cortex is responsible for executive functions, which include decision-making, peer pressure susceptibility, sensation-seeking impulses, and does not fully develop until after the age of 25. And one of my colleagues just gave me a paper, and we know physiologically some of the reasons that your prefrontal cortex is not developed is because myelination of your neural synapses takes a while. It takes, years for these things to develop. And so when you're still young, all these things are developing, and then it's just easier for us to get addicted to nicotine. So we know before you turn 25, as you get addicted to nicotine, the decision process making is just crippled, right, by your addiction to nicotine. And so it's just perpetual, and it just creates more problems and more problems. And so that's why the range age of 13 to 20 is such an at-risk range physiologically, but also, socially and everything else. So I'm going to be going into the California Tobacco 21 law. And so in 2016, California passed its own law that mandated all tobacco and e-cigarette products to be sold to persons that are at age of 21. And so one of the big things about this presentation and about the research I've been doing is, we're trying to model what the federal tobacco 21 law will look like, because we've seen the California's law has been in place for 4 years now, 3.5, 4 years. And we've seen significant impacts, and we know that it's working. And so my whole presentation is, comparing the two, and also looking at how the federal 21 law is going to be such a significant public health victory. So California's 21 law was signed by Governor Jerry Brown on May 2nd, 2016. It raised the minimum legal sale age of tobacco products to 21 years of age, but it also expanded California's smoke-free workplace laws. It broadened California's tobacco-free school laws to cover all school property, and it increased licensing fees for distributing and selling tobacco products. And like I mentioned before, it expanded the law to also include e-cigarettes. But it wasn't easy. California legislators fought against big tobacco, e-cig companies, and also the California Retailers Association. Some of the biggest obstacles they had to face were, these companies were arguing that more regulation was going to inhibit the success of their business. They're going to make less money. And another thing was, it's going to hurt the brick and mortar businesses that, who sell these kinds of products. But those things aren't affecting, those things are, they're not considering public health. They're considering money, and they're considering those kinds of things. And they're not looking at, millions of people living with smoking related diseases, and millions of youth addicted to nicotine, and, making bad decisions. And so actually, Drew's post-bac student, Melita Johnson, actually had a very significant impact on the passing of this law. And, give a little background on her. She was a post-bac student working under Dr. Friedman's lab group. And she, similarly to this, she had a presentation where she discussed the importance of, raising the law to 21, or raising the sale age to 21, and specifically talking about the physiological effects and how nicotine is very crippling to the youth. Senator Ed Hernandez actually attended some type of, I think it was a tobacco cessation program day at Drew, the day Melita gave a presentation. And, we found out later that her presentation had a significant impact on the whole legislation process. He hadn't realized, I guess, of how, I guess he didn't understand the science and the physiology of nicotine and youth dependence. And so after this presentation, and after all the work, Melita and Dr. Friedman's group did, we know that, they had a significant impact on Senator Hernandez's bill, and how he pushed it into, or he pushed it to Governor Brown's desk, and getting the legal age for purchasing products to, be raised to 21. And so, go CDU. And so, going into some of the data that's been released by California Tobacco Control Program and the California Department of Public Health, if we look at this data, this is, for me, this looks great, right? Over the last 16 years, we've seen a very huge decrease in the smoking cessation rate in California youth. But what's really satisfying, I guess, it's not something to be satisfied about, but this right here, I don't know if you can see my mouse, but this whole gap, or not gap, but I guess this drop from when the law was passed, in 2015, 2016, all the way down to 2018, 2019. And so we're seeing youth cigarette usage dropping considerably in the last 3 years in California alone. You can see the whole trend line in the United States is dropping, but the drop in California is even more significant, and it has to do with the new law that was passed in 2016. So this is, I did some background research on a paper put out by the Zhang Group, and they specifically looked at California's 21 law, and they surveyed thousands of businesses, and they surveyed thousands of youth, and they came up with a lot of great data showing how significant and showing how successful California T21 has been in the last 3 years. So in 2019, using both physical and online surveys, the Zhang Group found that 63.6% of young adults aged 18 to 24 were aware of the law, and awareness was high across all ethnic groups. Over 60% of young adults surveyed agreed that raising the age of tobacco sales to 21 years of age would decrease youth tobacco use, and awareness of the law was at 98.6% among tobacco retail owners. 85% of those surveyed agreed that it was easy to comply with the law. And so, some of the concerns with passing these kinds of law was, are we going to get the word out? Are people going to enforce these laws? But the Zhang Group showed, right, 85.6% of these retailers said they were complying. It was easy to comply. And so that's a very good rate that we should consider for the federal law. So this is the California Department of Public Health data that shows the obtainability, and you can see that in 2018 the obtainability for youth dropped considerably. So in 2016, over 10% of shops were still selling to youth that were 16 or 17 years old, so they were not compliant with the 18-year limit. But by 2018, after the age was raised to 21, only 5.4% of retailers were selling to youth under the age of 21. Now that is, that's still scary, right? There shouldn't be any sales to anyone under the age of 21, but this trend of seeing this decrease and compliance by retailers is very reassuring. So if you look at this graph, this is titled "The Underage Sales Rate to Young Adults Among Licensed Tobacco Retailers in California by Retailer Type." So the highest we see in California, obviously, is still tobacco and vape shops, these brick and mortar shops. You can see like supermarkets, liquor stores, convenience stores, they're pretty, compliant with the rule, the law, but, that's still concerning that 1 in 3 tobacco and vape shops are still selling to underage youth. All these numbers are from 2019, and from a graph that I saw in 2016, these are considerably lower, but it's still a little concerning, that almost 1 in 3 vape shops still sell to the underage. So this is where it gets very interesting. So the tobacco use rate among California youth by product type in 2018. So you see everything is basically zero. Cigars, 0.4%. Smokeless tobacco, so chewing tobacco, 0.5%. Hookah, 1.5%. Cigarettes, 1.2%. Little cigars or cigarillos, 2.0%. But if you look at the far left one, 9.4% are still using flavored products, and 1.5% are non-flavored products. But if you combine the two, that is 11% of youth are still using e-cigarettes. And so the law is working for everything except e-cigarettes. Well, it is working for e-cigarettes, but I think e-cigarettes, because there's such a online market for them, and such a, they're so easily obtained, That's the one thing that's been hard to control. And a little bit later, I'll be talking about, things we can implement so that we can control these things. So just to continue reviewing on how we know that the federal tobacco 21 law is going to be so successful. So in 2014, New York City raised their minimum legal sale age to 21. And they have seen steady declines in adolescent tobacco use. In 2018, Oregon passed their own 21 law. Their preliminary data by their public health department has shown significant decreases in tobacco use initiation among youth aged 13 to 17 and young adults 18 to 21, which translates to they're not getting their hands on the products, which is what we want. We want to keep these products away from the youth, keep them out of their hands so they can't use them. In 2016, Hawaii also passed their own 21 law, and they found that the average monthly cigarette sales were dropping 4.4%. So again, we're keeping the products out of the youth's hands. So going into a little bit more of exactly some of the benefits that I think and that we think are going to come out from the new law. So the first one, obviously, is a reduction in youth tobacco use. But with benefits come challenges. And so we know that the e-cigarette usage among youth is still very high, and that is something we need to work on and something we need to tackle. Another benefit of the Tobacco 21 law, the federal Tobacco 21 law, is that it's going to delay the age when youth first start smoking. So as I mentioned earlier, 18 to 21 or even earlier, 16 to 21 is very at-risk age for creating nicotine dependence, creating nicotine addiction. And so if we can delay that age, when you're 22, 23, 24, a little smarter, a little more mature, you can make, better decisions for yourself. We're not ever going to be perfect, but I feel like at 25, in my age, at 25, 26, I'm making better decisions than I was when I was 17 or 18. Another one is the reduction of underage smoking and smoking in general in tobacco belt states. And I have a slide on that I'll go over in a bit. Another benefit is the decreased underage attempts to buy tobacco products and an increase in the age gap between adolescents initiating tobacco use and those who can legally provide them with products, which is known as shoulder tapping. We know this is, some of the graphics that I showed earlier where they're discussing that, 1 in 3 retail shops are still possibly selling to underage youth. A lot of it comes through this shoulder tapping method, which is, you go in, you find someone that looks polite, and you hand them, $10 and say, can you buy me this product? And, some people don't really care and they'll just do it for others. And, that's something, we need to also be considering. The U.S. Tobacco 21 law is also going to be creating a reduction in the use of cigars, cigarillos, flavor products, hookahs, anything tobacco related. And so that's also a very great benefit. And we've already seen that data from California in 2019, where the youth were using almost 0% of these products in California alone. And so we know that's going to translate to federal stats as well. So just continuing, some more benefits, the reduction in adult tobacco use and decreased number of new smokers, a shift of blame from kids to retailers. So retailers will have to enforce the law at risk of penalization. So this is also something that we need to ponder and think about. We need to make sure that the retailers are held accountable. So those 1 in 3 vape shops in California that are still suspectedly selling to the youth, there needs to be some type of penalization or some type of consequence, so that, this law is enforced. This federal new 21 law is also going to increase the awareness of the risks of tobacco and e-cigarette usage. And so we know that, cigarette smoking has long been considered, cancer causing, all these different health problems and diseases. And but e-cigarettes, they're still fairly new, and there's been a lot of data that has been published. But I still feel like in social media and among youth, they're not considered dangerous yet. And so we really need to work on making sure that the message gets sent out there that e-cigarette products aren't safe. And, a lot of work has been done at Drew alone, in our lab group alone, showing, e-cigarettes cause all kinds of, cardiometabolic you know, it's related to, you know, hepatic failure. It's related to cirrhosis. It's related to basically every, I mean, even in, you know, we've connected it to breast cancer. And so we just need to make sure this kind of information gets out there to the public, and not just, you know, being, you know, published in scientific journals. And then, you know, we're talking about them in a Friday noon lecture series, but we need to make sure that everyone knows how dangerous these products are. And then going to my last two benefits. So the 21 law is going to result in improved and stricter enforcement of the new US 21 law at all levels of government, including the military. And so this one was actually very important, because a lot of the laws that were passed earlier by other states and other local municipalities, they excluded the military. So military bases or military personnel, even if they weren't 21, they could still buy products because they were protected under law. However, the federal 21 law does include military. And so, you know, that is significant, because a lot of our service members are under the age of 21, and we do know, you know, there's a high risk and high usage rate of cigarettes and tobacco products in the military. So, you know, that's also a really great benefit for them. And in general, right, we're going to see reduced smoking morbidity and mortality. So going into a little bit about the Tobacco Nation quickly. So the Tobacco Nation is a group of 12 states: Alabama, Arkansas, Indiana, Kentucky, Louisiana, Michigan, Mississippi, Missouri, Ohio, Oklahoma, Tennessee, and West Virginia. With more than 66 million residents, they include roughly 20% of the US population. However, both youth and adult residents of Tobacco Nation smoke at higher rates than the US. 22% of adults smoke and 11% of youth smoke. And that those are both considerably higher, almost double the national rate. And so we know that the Tobacco 21 law is going to significantly affect these states in general, or all states, but these states in general who are well known to be, you know, heavily addicted to nicotine and, you know, heavily involved with tobacco. This is going to really help those states, you know, with their morbidity and with their mortality rates and with their overall public health. So if you look at some of these stats that I pulled from the truthinitiative.org, their survey that they did in 2017 showed that the Tobacco Nation was ready, and they are ready for a Tobacco 21 law. And so if you look at these rates that are compared to the U.S. surveys, you know, 61% of residents in Tobacco Nation, or, you know, residents of those 12 states, they are actually in favor of banning the sale of tobacco products in stores near schools. 72%, just like the national rate, they are in favor of raising the minimum age of 21. And so, you know, with a wide or with, you know, widespread public, I guess, want for a law, an actual passing of the law is going to, you know, really have a positive effect on the smoking rates. And so this is some estimation that we did. So we came up with this stat. So by 2026, we should see, or we will see, almost a 10% decline in adult smoking rates. And I came about this rate, or this percentage, by looking at data from the America's Health Rankings and basically creating a trend line or a curve from 2016 to 2019 based off California's data. And so right now, around 500,000 smokers die of smoking-related diseases. And if we, you know, compare the 10% decline in adult smoking rates in the next 10 years alone, you know, we're going to see 50,000 people less, or 50,000 less deaths related to smoking. So, you know, the federal Tobacco 21 law, we're going to see, you know, healthier generations in the future, hopefully tobacco-free and nicotine-free. And so the data that I just presented also is substantiated by the Institute of Medicine. This study was published last year in 2019. They projected a 12% decrease in tobacco product use prevalence in adults. They predicted that the Tobacco 21 law will reduce smoking by 25% among 15 to 17-year-olds and 15% among those 18 to 20 years old. They also estimated that they're going to prevent the Federal 21 law is going to prevent roughly 223,000 fewer premature deaths. And they also estimated around 50,000 fewer deaths from lung cancer after the passage of this new law. So just some problems with tobacco 21, right? We still have the whole youth addiction, e-cigarettes, shoulder tapping, as I mentioned. We need to figure out a way to, enforce this law and online sales. And so, as I mentioned earlier, actually, it's a screenshot of Juul. If you look at that, all you have to do is click I am 21 years older and they let you in. But recently, Juul is one of the only products that actually has a little more enforcement of that 21 years of age. They actually do ask you to, I think, put in a home address so they can confirm something. But other smaller products that don't necessarily care, it's as simple as just clicking I am 21 accept. So these are some future steps that you and I and everyone should be taking. So we need to be publicizing the positive effects of raising the tobacco purchase age to 21. We've seen a huge drop, almost 10%, in cigarette smoking in youth in just 3 years in California alone. We saw that data in New York City, we saw the data in Oregon, we saw the data in Hawaii. We saw that the estimated data that I put out, the estimated data from the Institute of Medicine, the federal tobacco 21 law is going to be a major public health victory. We need to make sure that people know this, so that as we push for enforcement of the new law, we're able to provide hardcore data. A lot of people, right, they want data, and so we can show them, right, look at this data in California. In just 3 years, the rates have dropped significantly because of this new law. Another thing we need to be doing is we need to push for the taxation of e-cigarettes. So e-cigarettes currently under this new law aren't taxed heavily like cigarettes are. I think that's the next big step we need to be taking. Right, so it's been well documented that the taxation of combustible cigarettes drastically led to decreased sales. And so we need to make sure we get this done. Push for much tighter regulation of online sales. Like I just showed earlier, it's very easy to just go online and buy a product. And then, the next one is push for the ban of all flavored vaping products. We know, luckily Juul, they've banned their products or their flavored products, even though they're selling menthol. But Puff Bar, right? These new products, there's absolutely no control over what they're selling. And if you saw some of those products like Juicy Bubblegum and Mango Madness, like all these things just appeal to the youth. They read these things, they sound good, they taste good, they smell good. So we really need to work on pushing for a ban of all flavored vaping products as well. And, just finishing off, spreading awareness of how dangerous all tobacco products are, continuing to push forward, the whole trend of, cigarettes are still bad and e-cigarettes are just as bad. And, finishing up, I have a few minutes left. So I'm going to be talking about a new product. And so this last, step we can be taking is be vigilant of new products that are coming out. So this new product that's coming out is called the Heat Not Burn Tobacco System. Specifically, IQOS is one of the main products. It's being put out by Philip Morris International. Stands for I Quit Ordinary Smoking. So what is it? Tobacco burns in a cigarette at over 600 degrees Celsius. And we know in e-cigarettes, they burn up to 350, 300. But that's e-juice. It's a little different than what these products are using. These products they're called, if you go to the next slide, they use it's a tobacco plug, which has just concentrated tobacco leaves soaked in propylene glycol. So it's not nicotine extracted from tobacco leaves, but it's tobacco leaves themselves in propylene glycol. So that's the difference between that and an e-cigarette or like a vape, right? Because vapes use e-juice, which contains concentrated nicotine in propylene glycol glycerol, but these contain just tobacco leaves, like like a paste that you put into this product, and it heats it. It doesn't burn it, and it heats it. And so this product is arguing that, with just heating tobacco leaves and not burning it, it doesn't create combustion. It doesn't create smoke. There's no harmful constituents that are being burnt or being, released into the air. And, the studies that are being put out are by these big tobacco companies, and they're saying, that their products are safe. Like they are actually saying that their products are completely safe. So just this is something that they've been saying, switching to tobacco heating systems, may have a positive impact on smokers' health. It's not a source of secondhand smoke, and there's no harmful constituents that are being released. However, going for a quick review of 3 papers that I looked at by the Farsalinos group that they put out in tobacco nicotine research last year, the Outer group in JAMA, and the Liu group in tobacco control. So all 3 of these papers are very significant in the field of medicine and the field of tobacco and nicotine. So all 3 groups have come out with scientifically proven, peer-reviewed research saying these products are not safe. So the Farsalinos group, they compared these products with e-cigarettes and tobacco, and they found that the heat not burn or the tobacco burning or tobacco heating systems delivers nicotine at levels higher than e-cigarettes. They provide high levels of nicotine in general, although they're a little bit less than the type of cigarette that they had used. The second study, they analyzed the toxic constituents of heat not burn products. So they, they used the aerosol and they put it through an HPLC, and they found, if you look at the 3rd or 4th bullet point in the results, the IQOS, so the I Quit ordinary smoking devices, contains elements from pyrolysis and thermogenic degradation, volatile organic compounds, including polycyclic aromatic hydrocarbons and carbon monoxide. And we know carbon monoxide is absolute poison. So they're saying these companies are lying, right? These products are not safe. And lastly, this was more of a social look into what these new products are going to create. And they found that in 3 years in Italy, IQOS has already infiltrated the population, and they predict that IQOS is definitely going to create a whole new generation of nicotine addiction. Presently in the United States, as of last year, the FDA has authorized the marketing of IQOS. They did place some marketing restrictions, but if you look at this direct quote I pulled from FDA.gov, the agency determined that authorizing these products for the US market is appropriate for the protection of the public health because, among several key considerations, the products produce fewer or lower levels of some toxins than combustible cigarettes. That is very concerning. Regardless of what's in these products, the FDA should not come out and say these might be safer. And so luckily, as of last year and as of I think some Google searching I did about a week ago, they're still only available in Atlanta. Altria is the one company that has some brick and mortar stores in some Atlanta malls. You can order it online. It was, I signed up just so I could see if I could get it. It was a little complicated, and they did require some age verification tools. But I think ultimately I was one step away from putting in credit card information and ordering myself an IQOS. So another thing to be aware of, the vaping epidemic is still going strong. There's new products that are always being, implemented, always being developed. But we do need to remember that the Federal Tobacco 21 law was a significant public health victory. It's going to be, and there are some steps that we need to be taking in order to make sure that this gets more publicity and that it'll become a very huge, significant victory for all of us. So I'd just like to acknowledge, my mentors, Dr. Freeman, Dr. Liu, my classmate and my peer, Jason Martinez, and the whole Freeman Lab Group in the Division of Endocrinology at Drew, and obviously Drew itself. And now we're open to some questions. And so just, these are my friendly reminders of the steps that you and I should be taking to make sure that the Federal 21 law, becomes what we predict it to become. So thank you very much.
Thank you very much. So at this time, we'll move into Q&A. You may submit your questions via the chat box or unmute to ask a question. To unmute, select the microphone in the lower left corner. Once you've asked your question, please remute to avoid any background noise. Thank you.
Is there any particular order?
No, I just go ahead.
Okay, making sure. First, very good presentation. Um, very informative. My question is for the. You showed a slide on the Institute of Medicine.
Mm-hmm.
Can you go back to that slide for a second? Is about their results. Yeah, that one. I mean, I know I'm naive. I don't know as much. I mean, I'm not as informed about how the law works per se, but they banned they banned you can't buy nicotine products under 21. But the Institute of Medicine only predicts a 15% decrease in usage of people 18 to 20. 18 to 20. I'm sorry, I'm saying badly. If it's banned from 18 to 21, how come How come there's such a small decrease? How come it's not a bigger decrease?
So yeah, I looked into that, and it's because that group is still getting their hands on products. I would assume it'd be a much higher, right, much higher decrease. But the law itself is passed in December, and there hasn't been any data yet to show compliance federally. So this is they estimated that this is the federal or the national decrease, and so perhaps in California that number is much higher because California has strict compliance, or not strict, but has much better compliance. And so at the national level, we don't know how compliant other states are going to be. And so this was just a general estimate that they put out for that age group. So yes, I would assume it should and will be higher once the law is has more publicity and states are becoming more compliant. But as of now, I guess that's just the number we have to live with, even though we want it to be much higher.
Thank you very much. That's a good answer.
Any other questions?
Can I ask one more question then, just because no one else has one?
Of course.
Okay, thank you. I know the data is young, but is there any data on how many people who do e-cigarettes, how many kids do e-cigarettes when they get older convert to regular cigarettes? Is there much data on that?
Yes, there is data. I didn't include it in my presentation, and I should have. But I mean, I'll find it for you later, Julian. But there is a significant risk of e-cigarette users turning into dual users or switching from e-cigs to cigarettes after certain number of years. I don't know the number off the top of my head, but there's that really big concern, and that's why this whole movement of me reiterating that e-cigs creates a new generation of nicotine addiction. But I can find that number. I've seen it in a couple of the papers that I read, but I just didn't include it today. But it is pretty significant. E-cigarette users becoming dual users or switching to cigarettes after a certain number of years, right? I mean, e-cigarettes, or at least vapes, it's kind of like an age group or age appropriate type of product. And so maybe when you hit you're older, you don't want to be using a USB stick. You switch to cigarettes when you need your nicotine fix, things like that. There's a
And we have
question.
another.
Yeah.
Perfect. Thank you.
Yeah. So there's a question from Sylvia Drew. How can we keep this threat in front of the public with everyone so preoccupied with COVID-19? So yes, I think that there are multiple answers to this question alone. Few weeks ago, I did a presentation in our lab meeting, just talking about e-cigarettes and cigarettes and the risk factors for COVID-19. And so I think that's something we can be considering. Obviously, COVID-19 is going to be around for a while, and it's going to dominate basically all media and all news outlets for a while. But I think one way we can connect the two, or make sure that the federal 21 law still gets publicity, is to talk about the risk factors that vaping and cigarette smoking creates for COVID-19. And so we know, without getting into too much science, COVID-19, or the SARS-CoV-2 virus, sorry, not connects, but it binds to the ACE2 receptor in the lung, in lung epithelial cells. And so we know from previous research that nicotine upregulates the expression of ACE2 receptors in the lung. And so, we can kind of create that connection that, the upregulation of ACE2 is going to create more sites for COVID-19 infections and COVID-19 binding in the lung cells. So that's one thing we can consider, trying to connect the two. And also, smoking and vaping, it's already going to cause you to have risk factors in your lungs. You're already going to have compromised immune systems and compromised lungs. And so, with the respiratory illness and respiratory virus, there's always going to be that risk that's going to be perpetuated with e-cigarette and cigarette smoking. But in general, I wish I had an answer of how we could, make sure Federal 21 law gets publicized. I mean, you can post on your Facebooks and Instagrams constantly, which I do. But at the same time, with COVID-19, there's almost nothing else that's being shown, but we need to work hard to make sure that it does get shown. Thank you.
Great job, Sam. Really good.
Thank you.
Thank you.
One more question from Ms. Plus. Do you think more youth or others are using more because of stress and anxiety of COVID-19? So yes, I just talked to, I guess, a mentor of mine this morning, trying to look into those kinds of things. And definitely, I think, especially with staying home, not being able to go out, we know that smoking and vaping is a social, it oftentimes is, like a social thing to do. But, some people do use it because, right? I mean, you use nicotine or, you use drugs or those kinds of things to cope with these kinds of things. And so I think, this definitely does have a connection. And I think stress and anxiety of COVID-19 definitely has been impacting e-cigarette usage or smoking, not only in youth, but in the adult population. So that is something we do need to consider. And I definitely think, that staying at home and just the whole idea and the whole stress of a pandemic is not helping at all.
Thank you.
Mm-hmm.
All right. Well, given that we're coming up at the top of the hour, we will go ahead and wrap up. Thank you again to everyone for joining today's Friday Noon Lecture Series presentation. We would ask that you take a few minutes to complete a short evaluation, which has been entered into the chat box. It may not display as a link, so if not, please copy and paste it into your web browser if needed. And thank you again to Sam Kim, our presenter today, for an excellent presentation. This concludes our Friday Noon Lecture Series for today. Thank you, everyone.
Thank you, everyone.
Great job, Sam. Very good presentation.
Thank you.
Good job.
Good job, Sam.
Good job.
Thank you so much.
Thank you so much.
Great job.
Thanks, everybody.